Think about the last time you had a headache. What did you do? You probably reached into a drawer, grabbed a small white pill, swallowed it with a sip of water, and 20 minutes later, it was gone. Now imagine that pill doesn't exist. Not just that specific pill. Imagine nothing like it exists. No aspirin, no ibuprofen, no Tylenol, no dentist's numbing gel, no anesthesia, nothing. That headache just stays for hours, maybe days. And that's the easy version of the problem because headaches were the least of your ancestors' worries. Now imagine you break your leg. Not a clean break either. A bad one, bone through skin, out in the open, miles from anything resembling help. In the modern world, that's an ambulance ride and a morphine drip. For most of human history, that was just your reality now. You'd feel every single second of it. No numbing, no sedation, nothing to make the world go soft and blurry while your body did its worst. And yet here's the almost unbelievable part. Humans survived this. Not just survived, but thrived. Reproduced, built civilizations, painted on cave walls, raised children. For roughly 300,000 years, all without the thing you consider a basic human right every time you stub your toe. So how? How did an entire species survive hundreds of thousands of years of broken bones, infected teeth, childbirth, animal attacks, and disease without a single modern painkiller? The answer isn't just they toughed it out. That's the lazy version of the story. The real answer involves plant chemistry. Your ancestors reverse-engineered through trial and error, brutal but genuinely effective surgical techniques, an entire architecture of social and psychological coping mechanisms, and a relationship with pain itself that was fundamentally different from yours. Some of it will shock you, some of it will make you wince, and some of it, weirdly, might make you reconsider what modern pain relief has actually cost us. Let's start with the myth, because you probably have one sitting in your head right now without even realizing it. You probably think ancient humans just suffered, stoically, silently, gritted their teeth and endured whatever came, because that's what primitive people did, right? No complex inner life, no sophisticated coping, just raw endurance like an animal. That picture is almost entirely wrong. Ancient humans were not passive victims of pain. They were active, resourceful problem solvers who developed an enormous toolkit for managing it: chemical, physical, psychological, and social. Some of what they figured out is so effective that modern medicine still uses close descendants of it today. You are, quite literally, taking a chemically refined version of an ancient human's discovery every time you take an aspirin. Let that sink in for a second. The gap between ancient superstition and modern medicine is a lot blurrier than you were taught. Let's talk about plants first, because this is where the story gets genuinely impressive. Long before anyone understood what a chemical compound was, long before anyone had the faintest idea what anti-inflammatory meant, ancient humans were running an unlabeled multi-thousand-year clinical trial on the natural world. Eat this leaf, feel a little better. Chew this bark, the swelling goes down. Drink this root boiled in water, the fever breaks. It was slow, it was dangerous, and a lot of people almost certainly died figuring it out. But the accumulated knowledge was staggering. Willow bark is probably the single best example, and it deserves real credit here. For thousands of years across wildly different cultures, ancient Egypt, ancient Greece, indigenous cultures throughout North America, people independently discovered that chewing on the bark of willow trees reduced pain and brought down fevers. They had no idea why. They didn't know willow bark contains a compound called salicin, which your body converts into salicylic acid, a substance that reduces inflammation and blocks pain signals. They just knew it worked, and that was enough to pass the knowledge down through countless generations. Thousands of years later, chemists isolated that compound, tweaked it slightly for a synthetic version that was gentler on the stomach, and called it acetylsalicylic acid. You know it by a different name: aspirin. The best-selling painkiller in human history is, at its chemical core, an ancient human's tree bark remedy with a lab coat on. But that wasn't even close to the weirdest one. Let's talk about the poppy. Somewhere around 5,000 years ago, possibly earlier, humans in the region of modern-day Mesopotamia discovered that a specific flower, when you sliced its seed pod and let the sap ooze out and dry, produced a substance that did something no plant had done before. It didn't just dull pain. It erased it. and it wrapped the mind in a kind of heavy, floating calm. The Sumerians reportedly called it the joy plant. That substance was opium, and its active compounds, morphine, codeine, remain, to this day, among the most powerful pain relief tools medicine has ever produced. Every time a hospital administers morphine to a patient in agony after surgery, they are using a purified, standardized version of something a Bronze Age farmer figured out by cutting open a flower and watching what happened. The danger, of course, was that ancient humans had no way to measure dosage precisely. Too little, and the pain remained. Too much, and you might not wake up. This wasn't a controlled pharmacy with milligram precision. This was raw trial and error, generation after generation refining the recipe through observation, sometimes at a devastating cost. But the fact that they got as close as they did, with absolutely no chemistry, no microscopes, no scientific method as we understand it, is honestly one of the most underrated achievements in the history of medicine. Then there's coca. In the Andes, indigenous peoples discovered that chewing the leaves of the coca plant did something remarkable at high altitude, in brutal cold. During long physical exertion, it numbed pain, suppressed hunger, and gave a surge of stamina. Modern science eventually isolated the active compound and called it cocaine. And while its recreational and destructive modern history is well documented, its original discovery was pure survival pharmacology. Ancient people in the high Andes, without labs, without theory, figured out that this specific leaf let them work through pain and exhaustion that would otherwise stop them cold. Even today, a diluted, purified version of cocaine's numbing properties is used in some medical settings as a local anesthetic. The line between ancient survival tool and modern pharmaceutical is thinner than you'd expect. Cannabis has a similarly deep history. Archaeological evidence of cannabis use for pain and inflammation stretches back thousands of years across Asia and the Middle East. Ancient Chinese medical texts describe it being used specifically for pain relief. Egyptian medical papyri mention plant-based treatments for inflammation that modern researchers believe likely included cannabis-related preparations. This wasn't recreational use in the modern sense. This was medicine developed independently over and over in cultures that had no contact with each other, all arriving at similar conclusions because the plant genuinely worked. Here's the thing that should stop you for a second. None of these discoveries happened in a lab. There was no controlled experiment, no double-blind trial, no scientific paper. This was thousands of years of humans essentially testing on themselves, generation after generation, slowly building a mental library of, this plant helps, this plant is dangerous, this plant does nothing, this plant kills you outright. That knowledge was passed down orally, through healers, through shamans, through the person in the group whose entire social role was remembering which plants did what. Losing that person, without them passing the knowledge along first, could genuinely set an entire community back. This wasn't superstition dressed up as medicine. In a very real sense, it was medicine, just running on an information system built entirely out of human memory instead of written journals. Now let's talk about something that tends to make modern audiences deeply uncomfortable. What ancient humans did when the pain was severe and there was no plant strong enough to fully handle it. Because sometimes the injury wasn't a headache or a sore muscle. Sometimes it was a shattered bone. Sometimes it was a wound that had turned septic and was killing you slowly. And in those moments, ancient healers didn't just give up, they performed surgery. Yes, actual surgery. One of the most jaw-dropping pieces of evidence in all of prehistoric medicine is something called trepanation, the deliberate drilling or scraping of a hole into a living human skull. Archaeologists have found trepanned skulls dating back over 7,000 years on every inhabited continent, performed with nothing but sharpened stone tools. And here's the detail that changes everything. Many of these skulls show clear signs of bone healing around the hole. That means the patient survived the procedure, not just survived the surgery itself, but lived long enough afterward for new bone to grow back around the edges of the hole, sometimes for years. Think about what that actually required. Someone had to hold a fully conscious human being still while another person used a sharp stone to grind or drill through their skull, layer by layer, avoiding the brain itself for what was likely an hour or more of continuous, excruciating pain. No anesthesia strong enough to fully knock the patient out. No sterile environment. no modern understanding of infection. And yet the survival rate implied by the healed bone evidence is genuinely impressive by any standard, let alone a Stone Age one. Why would anyone do this? Theories vary. Some researchers believe it was used to relieve pressure from head trauma or brain swelling, which, remarkably, has a real medical basis. Modern neurosurgery still occasionally performs a version of this exact procedure for the exact same reason, called a craniotomy. Others believe it was used to treat severe headaches, seizures, or what ancient peoples may have interpreted as evil spirits trapped inside the skull. Whatever the belief system behind it, the physical technique itself was strikingly sound, and the survival evidence suggests that whoever was performing these operations had genuine, hard-won anatomical knowledge and probably a working system for managing the pain of the procedure well enough that patients didn't simply die of shock. That pain management likely involved a combination of things working together. Heavy doses of whatever plant-based sedative was available in that region. Opium, alcohol, datura, or other psychoactive plants known to induce a stupor. Physical restraint, sometimes by multiple people holding the patient down. And, disturbingly but effectively, a certain degree of induced shock or unconsciousness through blood loss or extreme physiological stress, which, while dangerous, does genuinely reduce the brain's ability to process pain in real time. None of this was gentle. None of this was safe by modern standards. But it worked often enough that the practice spread, independently, across cultures that never had contact with each other, which tells you something important. When something in ancient medicine kept showing up over and over across unrelated societies, it usually wasn't random. It usually meant it worked. Now, let's talk about the pain nobody could avoid, no matter how careful you were: childbirth. If you are a woman giving birth today, you have the option of an epidural, a needle placed with surgical precision into the space around your spinal cord, numbing you from the waist down. For the overwhelming majority of human history, that option simply did not exist. Ancient women gave birth fully conscious, fully present for every second of what is widely considered one of the most physically intense experiences a human body can go through. And they did it constantly, over and over, generation after generation. But here's what's genuinely fascinating. They weren't doing it alone, and they weren't doing it with zero support. Across traditional societies worldwide, childbirth was almost universally a communal event. Experienced women, midwives, mothers, grandmothers, surrounded the birthing woman, offering physical support, verbal reassurance, and practical techniques refined over generations. Certain plants were used to help manage pain and encourage contractions. Specific birthing positions, often upright or squatting rather than lying flat, were used because they genuinely make the physical process more efficient, a fact modern obstetrics has actually circled back to in recent decades after centuries of the opposite approach. There's also something worth understanding about the psychology of pain itself here, because it directly explains part of how ancient humans coped. Pain isn't purely a physical signal traveling up a nerve to your brain. It's also deeply shaped by context, fear, and social environment. Modern research on childbirth specifically has found that a woman's perceived level of pain can be significantly influenced by how supported, calm, and safe she feels during the process. Isolation and fear amplify pain. Presence, familiarity, and reassurance can genuinely blunt it. Ancient birthing customs built around constant surrounding support weren't just emotionally nice. They were, in a very real physiological sense, functioning as pain management. This wasn't unique to childbirth either. Ancient humans facing any kind of serious pain, an injury, an illness, a surgical procedure, were almost never facing it in isolation. They were surrounded by their group, held, talked to, distracted with stories or chanting or rhythmic sound. And this brings us to one of the most underrated pain management tools ancient humans had access to: each other. Here's a fact that sounds almost too strange to be true, but it's backed by real neuroscience. Physical touch and social bonding trigger the release of endorphins, your body's own natural opioid-like painkillers. When someone holds your hand during a painful moment, when a group surrounds you during suffering, your brain isn't just providing emotional comfort. It's biochemically dulling your experience of pain. Ancient humans living in tight, physically affectionate, constantly interconnected groups were essentially bathing in this effect their entire lives without knowing why it worked. Group rituals amplify this even further. Chanting, singing, communal dancing, and rhythmic drumming, all documented across countless ancient and traditional cultures, have been shown in modern studies to increase pain tolerance. Researchers studying this effect believe that synchronized group activity, moving or vocalizing in rhythm with others, triggers a stronger endorphin response than doing the same activity alone. Which means the fire-lit ceremonies, the group chanting around an injured or dying member of the tribe that might look to modern eyes like pure superstition, may have actually been functioning as a real, biologically effective form of collective pain relief. Superstition and science, in this case, were quietly doing the same job. Cold was another tool, and it's one your body still responds to exactly the same way it did 50,000 years ago. Ancient humans understood, empirically, that pressing something cold against an injury reduced swelling and dulled the sensation of pain. Cold water, snow, cold mud, or simply exposed skin in freezing air, all of it slows blood flow to an injured area and numbs nerve endings. You do the exact same thing today when you press a bag of frozen peas against a bruise. The mechanism hasn't changed. Only the packaging has. Heat played the opposite but equally important role, particularly for muscle pain, cramping, and certain types of chronic discomfort. Warm stones, heated water, or simply sitting close to a fire for extended periods increases blood flow to sore muscles and can genuinely ease certain kinds of pain. Ancient humans didn't need a physiology textbook to know this. They simply noticed, over thousands of repeated experiences, what made pain better and what made it worse, and passed that observational knowledge forward. Alcohol deserves its own mention here too, because its use as a crude but effective sedative and pain reliever stretches back an extraordinarily long time. Fermented beverages appear in the archaeological record going back at least 9,000 years, and their use in a medicinal, pain-numbing context is well documented across numerous ancient cultures. Before surgery, before a bone setting, before a tooth extraction, a heavy dose of alcohol was often the closest thing available to actual anesthesia. It didn't remove pain, but it dulled the brain's ability to fully register and remember it. And it relaxed the body enough that, in some cases, it made an otherwise impossible procedure survivable. This is also, frankly, why the image of the frontier doctor handing a patient a bottle of whiskey before pulling out a bullet isn't just a movie cliché. It's an accurate reflection of a technique with genuinely ancient roots. Now, let's address something important, because this video isn't trying to romanticize suffering. A huge amount of pain in the ancient world simply wasn't manageable at all. Infections that we would treat today with a 5-day course of antibiotics were, for most of human history, a death sentence, often a slow and agonizing one. A ruptured appendix, a severely infected tooth, a deep wound that turned septic. There was no answer for these things beyond herbal treatments that might slow the process, and prayer, ritual, or simple endurance while the body either fought it off or didn't. This is part of why average human lifespans were so much shorter for so much of history, and why something as small, by modern standards, as a cavity could genuinely kill you. This is important context because it means the story here isn't ancient humans had it figured out and modern medicine ruined everything. That's not true, and it would be dishonest to pretend otherwise. Modern anesthesia, modern antibiotics, and modern surgical techniques represent one of the greatest reductions in human suffering in the history of our species. Nobody sensible is arguing we should go back to trepanation with a sharpened rock. But here's the twist, and it's the part that makes this whole story worth telling. Some of what ancient humans figured out about pain wasn't just a desperate stopgap while waiting for real medicine to arrive. Some of it was genuinely correct, effective science, discovered through millennia of careful observation, decades before anyone had a microscope or understood a single biochemical pathway. Willow bark really does relieve pain. Opium really is one of the most powerful analgesics available to this day. Cold really does reduce swelling. Social bonding really does trigger natural pain-relieving chemicals in your brain. Ancient humans weren't just guessing and getting lucky. They were running the longest, most decentralized clinical trial in human history. and a startling amount of what they concluded turned out to hold up. And there's something else worth sitting with here. In stripping pain management down to a pill you take alone in a quiet room, modern life has also quietly stripped away the social dimension of suffering that ancient humans leaned on constantly. You're far less likely today to be surrounded by a tight circle of people during a painful moment than your ancestors were. You're far less likely to have your pain eased, even partially, by rhythmic chanting, by physical touch, by an entire community rallying around you. The chemistry your ancestors discovered by accident we bottled and perfected. The community they built around pain, almost by necessity, we've largely lost. It's worth asking which half of that equation actually mattered more. So, how did ancient humans survive without painkillers? The honest answer is that they didn't, not in the way you might assume. They built painkillers of their own, out of tree bark, poppy sap, coca leaves, cannabis, alcohol, cold water, and warm stones. They developed surgical techniques bold enough to drill into a living human skull and skilled enough that people regularly survived it. They surrounded every moment of serious pain, birth, injury, illness, death, with the physical and social presence of other human beings, tapping into a biochemical pain relief system inside their own bodies that they couldn't name but clearly understood how to trigger. And when none of that was enough, they endured, because there was simply no alternative, and because the alternative to enduring was not being here at all. You are the descendant of people who survived broken bones with willow bark and gritted teeth, who survived childbirth surrounded by a circle of other women instead of a hospital bed, who survived surgery performed with a sharpened rock and lived long enough to heal. Every time you swallow a pill and your headache disappears 20 minutes later without a second thought. You are standing on top of hundreds of thousands of years of people figuring this out the hard way, one desperate experiment at a time, so that you would never have to.